Hi, everyone, and welcome to the seventh episode of Battles and Voices. I'm Lathika, and I'm the founder and host.
And I'm Camden, and I'm the co-host. And we
And we
serve
serve
we
on
serve
the
on the
executive
executive
team
team
of
of Vitals and
Battles and Voices.
Voices.
Battles and Voices brings together healthcare providers to share their experiences in the medical field and inspire students all over the world.
Please welcome our guest, Miss Johnson.
Hello, I'm Raquel Johnson. I am new to nursing. I'm still within my first year. It's been an exciting experience, and I'm here to share with y'all.
Thank you so much for being here today. It means a lot to us that you're joining us on Vitals and Voices.
You're welcome.
Starting off, can you share a bit about your journey into medicine and what it was like making that career shift at 30 years old?
Yes, so I've always wanted to be a nurse. It was always a dream of mine, a goal of mine. Um, and I just always had to put it off for one reason or another, children and things. And we focused on my husband's career so long, and now is my time to shine. So I went ahead and bit the bullet and just started doing it. Um, I say the age that I am really benefited me. I know a lot of people are like, no, I'm too old for school. But for me, when I was a kid, I was not focused as much as I am now. Like grades weren't as important to me as they are now. Um, so I say like now it really benefited me because I know the importance of it. And it was a struggle at times, having children. Um, but for the most part, it was pretty all right. It was pretty okay.
So could you tell us a little bit more about what was the transition like moving from a medical to a surgery ortho unit to a cardiac unit? And what have you learned from working into both settings?
Um, the med surg unit or the ortho unit, um, we really didn't deal with sick patients. It was more of, making sure they didn't have or didn't get an infection after surgery. And it was just a lot of monitoring, just monitoring the vital signs, monitoring the patient, make sure they didn't move the wrong way, make sure they didn't turn their spine, things like that. And they only stayed with us for like one day and then they were discharged. Now on this cardiac unit, it's actually patients who are sick, who are having heart issues, where it could be just heart failure, where they're heart failure exacerbation, where they're holding on to fluids, so we're diuresing them, making them push the fluids out, so that their heart can pump better. Because with all the fluid on the heart, it makes it harder to pump. So it's definitely a different level of care, um, and it's a lot more intense on a cardiac unit than it is a med surg unit.
Moving on to the next question. How did your grandmother's experience influence your perspective on patient care?
Oh, it had a big influence on patient care, mainly about, you want to treat everybody like family, or that's what I want to do. Seeing my grandmother, on her deathbed, essentially, really just put into perspective the kind of care that I would want my family members to have. And so I would want to give that to anybody else's family member. I wouldn't want anybody treating my family less simply because it's not their family. So I make sure to always do my best.
I really love that, and patient care is very necessary nowadays.
Mhm.
Yes.
So nursing can be very demanding. What keeps you grounded and motivated on the hardest days?
I guess for me it would be, family in general, like, being able to help provide for my family, is a big deal. But also the satisfaction you get from patients when they actually say, thank you so much. Like, it really is an impact on my level of care and my level of satisfaction. Is just the simple thank yous for the job that I'm doing. Even though for me, it might not seem a lot, like, okay, I'm moving the table closer to you. Um, but it can get lost. Like, patient care is not always number one as it should be, or patient's side of things, where if you were in a hospital and you weren't able to move, wouldn't you want your cell phone next to you? Wouldn't you want your charger plugged in next to you? Wouldn't you want some water next to you? It's those little things that patients truly are grateful for.
That's so beautiful. More onto that patient stuff. You mentioned that listening to patients often changes their attitude. Can you describe a moment that when simply listening made a huge difference in patient care?
Oh, I mean, this is almost a weekly thing where on report, I mean, we're not necessarily supposed to be saying these things, but we give each other a little, hey, this patient's not in the best mood, or hey, be cautious when you go in there. They're a little grumpy this morning, or, we give each other little things like that on report. But every time I get that, it's never the case for me. I've never gone in there and had a patient yell at me or scream at me or curse me out or anything like that. I mean, yeah, you have your demented patients at times who do things like that, but they don't necessarily mean it. Um, but I did recently have a patient who I was told during report that they're extra grumpy and grouchy. But when I went in, I simply asked him, what are your goals for today? What do you want to do today? My goal for you is we were diuresing him. So my goal for you was to strict what you take into your mouth and allow you to urinate as much as possible. And his simple request was to put me on a bedside commode because he didn't want to use a urinal anymore. He had difficulty urinating while like laying down in bed, and he didn't want to do that. He wanted to sit down on a commode or stand up to urinate. And he was like, I said, okay, great. We can do that for you. You hit that button, you let me know when you need a potty, and I'll come in here and I'll help you out. And he was like, nobody else has said that to me, not once. Nobody else has even asked me that question. Nobody seems to care. And I was like, well, I care, and I'll do it. And so we did. And he was not grumpy at me, not once, never in that entire time. In fact, he thanked me, and I'm pretty sure he's probably one of the daisies that I carry on my badge now.
Why do you feel so strongly about preventing pressure ulcers, and how do you approach that in your daily practice?
Preventing pressure ulcers is very important to me. It's simple and easy because we check on our patients every hour to two anyway. So when you go in there to ask them if they need water, if they need to go to the bathroom, what you can do for them, you just simply move the pillow from underneath their right side and put it onto their left side. A lot of patients have slip pads underneath them anyway, so it's really easy to lift them up, though I can see the challenge of it being a heavier person, or if a patient is contracted, like their legs and their arms don't really move very well, it is a lot harder to turn them side to side. But in those cases, what you would want to do is get like a P500 bed, or a bed that self-inflates and deflates on its own to prevent the bed ulcers. Also, putting a Mepilex pad on any of the bony prominence areas, especially if you know that you're not going to be able to turn them every 2 hours like you should be, or that your PCT, delegation is always a big trick of the trade. If you know that your PCT can't get in there with you, or y'all can't figure something out, then definitely putting on some barrier creams, putting on a Mepilex pad or anything can help prevent a pressure ulcer, which once you get them, they're very hard to heal. They take a long time, and they're very easy to get infected, especially if they're down in the region of your um, groin area.
I love that you have a passionate um, subject in nursing. Um, Moving on to the next question. How do you balance the physical and emotional demands of nursing while still making sure patients feel truly cared for?
I think the biggest way that I do it, and I was taught this by one of my preceptors, was to ask a patient what their goal is for the day, and then do everything in your power to make that come true. So if their goal is to take a shower, then you call all the people that you need to call, you do the things that you need to do to get them that shower. If their goal is to simply stand up on the side of the bed to go potty, then you make sure that every time that call bell rings, you answer it so that you can go in there and do it, or pass the message on to your PCT or anybody else that's helping you with the patient that they would want to stand up and do that. They don't want to do it in the bed. Just asking them what they would like and then making it happen. Sometimes it's as simple as keeping their water cup full. Like it's almost like a waiter, you know. Um, that's pretty much it.
Mhm.
So receiving two Daisy Award nominations so early in your career is incredible. How did that feel, and what do you think patients recognized in you?
um, it felt amazing. I cried, of course, when I received them. Only because getting a Daisy Award or getting a Daisy nomination, I'm sorry, was a big goal in mine, and never did I think I would get it even before I was off of preceptorship. Um, but I think it's just listening to the patient, even if it's a patient who doesn't have family around and is delirious or has dementia or anything like that, still taking the time to to see what they need and what they want from the day. And then making it fun, exciting. A lot of people are coming in when they're feeling sick and they're feeling disgusting and they feel like they're not worthy or they feel like they're a burden. Just tell them, oh no, that'll be really quick. I'll help you. Just and even if you can't do it at that moment, just okay. I got to give more patients medications. Give me at 4:30. I'll be back in here and we'll make it happen. Set time frames for yourself and for the patient, but if you're going to set a time frame, you have to make sure that you meet that time frame, or come in there and say, hey, I know I told you that we're going to do this at 4:30. I'm a little behind, but I will be back before 5 to take care of you. Setting the expectation, I guess, is what the true goal is and reason for my daisies.
Well, congratulations again on being nominated for two Daisies already. Um, what advice would you like to give to somebody who's thinking about entering nursing later in life as you did?
Do it. Um, if it's truly your passion, do it. If you are searching for a paycheck, if you're just doing it to make your parents happy or anything like that, it's not going to be the job for you. If it's a passion for you and a true calling for you, because I feel that it is a true calling from God, if it's something that you in your heart want to do, is take care of patients and day to day be at the bedside, do it.
That's nice to hear. So looking ahead, what are your future goals as a nurse? So are there any specialties, leadership roles, or any projects you'd like to pursue?
I'm definitely trying to get on as many councils as I can. Um, but I'm also, my goal has always been to stay on a unit for at least 2 years, just so I can get the full effect of the unit. And then also within those 2 years, become like the charge nurse at one point, so I can really know the ins and outs of the unit, not necessarily just how the patients work, but how the whole flow of the unit is. And I am right now on track to be a charge. So my plan's working out as of now. But I do want to be here for 2 years, and then eventually go to maybe an ICU for 2 years, maybe even a cardiovascular ICU, being that I'm already on a cardiac unit now. Um, and then eventually the ED. My end goal is labor and delivery. The babies have my heart. That and NICU. A
Well,
lot of goals, a lot of aspirations.
sounds like it. But I just want to say thank you so much for sharing your story and walking us through your journey. It is truly inspiring.
Hearing about your experiences shows how much dedication and compassion go into the work you do every day. And to everyone tuning in, thank you for joining us on this episode of Battles and Voices. We're so glad that you could join us today, and we hope you'll keep coming back to hear more stories like this one.
If you'd enjoyed today's conversation, be sure to follow, share, and stay on the lookout for new episodes. We'll see you on next time in Vitals and Voices.